Have you ever wondered how you would know whether or not your baby was achieving a deep latch? We've all been there. Any of us who have desired to breastfeed our babies and have attempted latching have felt that feeling of doubt, not knowing if we're doing it well or doing it right. Well, I'm here today to help you reassure yourself that you either are getting a latch that optimizes breastfeeding, or to help you know, maybe things aren't going as well as what I thought, and I might need a little bit of help. I'm your host, Lo Nigrosh. I'm an international board certified lactation consultant and host of the Milk Making Minutes, where we explore breastfeeding struggles and triumphs so that you can feel as confident as possible about feeding your baby. Okay, so when I am working with a new family or when I am in the hospital getting to see lots of new families at once, the biggest question I get is, how do I know that my baby is latching well? Or how do I know that my baby is getting milk? So we're going to start with this question of the latch, and then in an upcoming episode, we will talk about how you know that milk is being transferred from your body to the baby. So the first thing you want to think about is positioning. And as breastfeeding supporters, there are two types of positioning that we're thinking about. We're thinking about the position of the baby and the position of the feeding parent. So there are lots of different positions, and there is not a one size fits all approach to great positioning. You might feel most comfortable sitting upright in the bed. You might feel most comfortable sitting in a chair. You might feel most comfortable laying back a little bit with the baby kind of on top of you. You might feel most comfortable lying on your side and getting baby lying on their side facing you. Some of the factors that will determine which is the right position for your body and which is the right position for your baby are going to be what type of birth you had, how sore you're feeling after the birth, whether or not you had a cesarean birth or a vaginal delivery. If you have really large breasts, there might be some positions that feel more comfortable. And if you have smaller breasts, there might be other positions that feel more comfortable. So if you are working with supporters at your place of delivery who insist on certain positions because they're best for newborns, just know that there's not one right position that is good for every new parent and every newborn. So if one position feels like it's awkward or that it's not working well for either you or for the baby, then you can shift. You can ask to be taught a different position. And really, the names of the positions don't matter as much as you being super comfortable. So we want to make sure that your body is in a position that allows you to be as rested as possible while you are holding the baby, that allows you to reduce your own tension, dropping your shoulders, making sure you can see baby's mouth without crinkling your neck too much, and putting pillows and other types of supports underneath your arms so that you are not holding up the baby. So some of the things that I see are shoulders up into the ears. So making sure you're able to kind of lower those down. I also see people holding up their baby the whole time instead of putting enough pillows underneath the baby so that they are as high as your breast. The other thing I see is parents, if they don't have enough support so that baby is brought up high enough, I see parents hunching over, which is okay for one feed or for two feeds, but for feeding a baby 8, 12, 15 times in a day, that hunched over position is going to lead to a lot of neck and upper back tension that is not sustainable for the months or years that you will be feeding your baby. So really get yourself set up so that you don't feel any areas of stress or fatigue while you are feeding your baby. And you may need your support person or your nurse to bring in more pillows or more blankets to be able to prop the baby up. And I always remind my clients that you will not always need so many pillows. You will learn to get into positions that are really comfortable for you and baby without all of the props. But in the early days and weeks when the learning curve is still very steep, using as many props as is necessary to support the baby is going to be really, really helpful. Now, a lot of people buy breastfeeding specific pillows or they're gifted by somebody else, and these can be really useful. But I want to say that a pillow that is very firm and that straps around you is probably going to be ideal. I've noticed pillows like the Boppy are much softer, and so baby sinks into them, and then they are not as high as they need to be, and they often are not wide enough so that they slide away from our postpartum bodies, and baby tends to fall in between the pillow and our bodies, and they almost are harder to use than just a normal pillow. But pillows such as my breast friend allow you to keep the pillow latched tightly around your body, and they're very firm so baby does not sink into it. And then because it is latched around you or clipped around you, baby does not fall in between the pillow and your body, regardless of the size or the shape of your current postpartum body. So once you've gotten yourself really comfortable, you feel like you're able to see the baby, you are not holding any strong areas of tension while holding the baby. Your hands are really just there for a little bit of extra support to the baby, but you could essentially let go and they would still be as high as they need to be. Then you're ready to start adjusting the infant positioning. Now, the infant can be in a variety of positions. They can be in that football hold that many people use on the side of their body, almost like you're carrying a football, like a running back carries a football when they're running. Many people use that after cesarean births. They can be in the classic cradle hold or the cross cradle hold, which is where the arm that, if the baby is facing towards your left, then your right arm is holding behind the baby's head, and then you're using your left hand to move your breast around. They can be in a side lying position or a laid back position, both of which I find really nice for new parents because baby can do a lot of the heavy lifting of finding the breast themselves, and you are not having to hold a baby up. So those are a variety of infant positions you can use, but in all of these positions, there are a couple of things that I see help babies to latch optimally. Number one is that the baby's ear, shoulder, and hip are aligned. That means their head is not turned to the side, but rather it's facing directly towards the breast. And in order to do this, what you need to think about is getting the baby's tummy touching your body. And it doesn't matter which position they are in. If you are in the football hold, you're going to turn the baby so that their body is facing your side. That allows them to come towards the breast with a straight neck. They don't have to twist their neck to try to latch. If they are in the cross cradle, you don't want their side touching your stomach. You want their stomach touching your stomach. So bringing them in really tight, tummy to tummy. Same thing with side lying, same thing with laid back. You really want to have that tummy to tummy positioning. If their head is twisted or their hips are twisted, it's going to make it much harder for them to get latched and stay latched and get an optimal amount of breast tissue in their mouth. The second thing when it comes to infant positioning is ensuring that their hands are free, that they are unwrapped, so no swaddles, no blankets wrapping them up, that their hands can go around the breast, and that their feet are touching something. So just like when you feel unsettled, if you sit in a really tall chair or at a bar stool and your feet dangle and they don't touch the ground, sometimes you feel a little lost in space or disoriented. Babies feel the same way. And so tucking a pillow or a blanket wherever their feet are dangling so that they have something to push on, something for their feet to touch, so they feel a little less lost in space. The next thing that you're going to be looking for is getting as optimal a latch as possible. Now, when I am working with families who are just in these early days or weeks of learning to latch, I have to keep in mind for myself and for the families I'm working with that perfection can be the enemy of good. So there is, quote unquote, a perfect latch. But as long as the pain level is very minimal and we can see sucks and we can hear swallows and baby can maintain that latch for a good amount of time and seem satiated afterwards, then let's not let perfection be the enemy of good. And so in order to achieve as optimal a latch as possible, when you get that baby aligned, tummy to tummy and facing your breast, you want to make sure that their chin comes to your breast first. And the chin will be aligned underneath the nipple and the areola. And once that chin comes to the breast first, you will notice that their neck is elongated. It's extended. So if your baby's neck is scrunched up and it's almost touching the top of their chest, then you know that they are probably going to have a hard time latching, maintaining a latch, and sucking and swallowing. So having a nice extended neck with the nipple pointed really up towards the nose will give them the opportunity to come chin first to the breast, and then once they open really wide with their tongue down, you may need to help them by bringing them quickly onto the breast. But you're going to wait until you see their mouth super wide, 140-degree angle with the tongue down. Then it's a quick move to the breast. You might miss it the first couple of times they open wide, and that's okay. You're going to wait until you get that wide latch, and then you're going to bring them right on. I know this is easier said than done. It can be hard for me with a newborn as well, and sometimes it takes me several tries to help get the baby latched, but really being patient and waiting for that wide mouth with the tongue down is going to mean that they get enough breast tissue in their mouth so that they are able to transfer milk by compressing the breast tissue and creating a vacuum instead of just one or the other. And that allows their tongue to be able to move properly and will minimize the amount of pain that you might be in. Now, you can have one hand holding the breast, one hand holding the baby, and if you're not figuring out how you might hold the breast and the baby, then you may need to switch hands. But if you're hearing this and you're thinking, oh my gosh, I'm not sure if I am latching the baby properly, I'm still feeling a lot of pain, I'm getting a lot of nipple damage, I don't know if I'm hearing swallows, I can't really picture what you're talking about with the ear, shoulder, and hip alignment, then I encourage you to reach out. Go to my website, www.quabbinbirthservices.com. I can do consults virtually for anyone across the world. I can often bill your insurance. and I can do consults in person here in the state of Massachusetts. So please, please reach out. Don't continue to suffer with painful breastfeeding thinking it's just going to go away on its own, because there is no guarantee it will if you are not adjusting the infant positioning, your positioning, and getting that optimal latch. So I can't wait to see your name pop up in my inbox so that I can help you achieve an optimal latch that is pain-free, that allows for the most amount of milk transfer possible. See you soon.